patterns of infection. Usually there's a reservoir, so the person that has it, the carrier. Then there is transmission, so it's passed onward. Then there's invasion, and then eventually once they get in, pathogenesis, which is the development of the disease. Transmission depends on two things. Number one, the resistance of the host. How is the person's immune system? Have they been vaccinated before? Have they been exposed to this before? Okay, so immune system, vaccine, previous exposure. Another thing, do they have protection from another factor? So if I have sickle cell, then I'm immune to malaria. Predisposing factors. Predisposing factors makes the body more susceptible to disease, so it increases their susceptibility. For example, gender, so male versus female. Females have short urethras. Inherited traits, such as mentioned, such as the sickle cell gene, so you have resistance to malaria. Climate and weather. In the winter months, more infections are prevalent because everyone is indoors, so we have a more spread. Fatigue. Are you tired? Are you stressed? Your age. We know that the young are more easily to get sick, and the old is get sick as well. The lifestyle. What type of lifestyle are you living? Are you washing your hands, or are you just putting dirty fingers in your mouth? And then finally, chemotherapy. Are you using antibiotics? Are you on chemo? Etc. Invasion and pathogenesis. The pathogen must overcome the host defense. If it wants to cause disease, it has to get past our defense system. So the incubation is the time between the infection and the signs. The prodromal is when you have early mild symptoms. The period of illness is when you have the most overt signs and symptoms. This is the time when you're the most contagious and when your immune system is the most active. Period of decline is when you start to see a decrease in your signs and symptoms. However, a secondary infection is possible. The period of convalescence is your recovery and repair, and spread can occur at any period. So if we take a look at this graph, we'll see that it shows us the stages of disease, and we'll see that it's over the time, over the number of microbes. And notice here the number of microbes increasing and then decreasing, right? So in the incubation period, there's no signs or symptoms because it's just starting to get used to your body. Then eventually, as they begin to rise, you start to see that you begin to have some mild signs or symptoms. And then they're really high, so that means that's when you have your most severe signs and symptoms. And of course, this is when you're the most contagious. And then the period of decline, here you'll see that there's a decrease in the signs and symptoms, but a secondary infection is still possible. And then the period of convalescence, recovery, and repair. And remember, the spread could occur at any time during this. So just because you see it going back down doesn't mean you don't have any bacteria still there. Reservoirs of infection are continual sources of infection. In human, we see that we have a diseased or a carrier. So someone that is a diseased would be someone that had like gonorrhea, or the carrier, right, would be HIV. Because carriers may have inapparent infections or latent diseases. Zoonosis, which is animal to human, and we can get it through direct contact or indirect contact, meaning coming in contact with the feces. So with the rabies virus, we know that, you get direct contact with that. Same thing with the Lyme disease. That's direct contact as well because a tick is biting you. And remember, some zoonosis may be transmitted to humans. Non-living reservoirs, fomites, things that are non-living. So soil and water. So we see this with Clostridium tetani, which causes tetanus, Clostridium botulism, which causes botulism, and of course ringworm. Direct versus indirect contact transmission. Direct requires close association between the infected and susceptible host. Indirect is spread by fomites. So some examples of fomites would be what? If you said table, pen, water, soil, etc., you are correct. Now, direct is perfectly shown here where we see a mom hugging her baby. And of course, if that baby's sick, then it passes onward to mommy. Droplet transmission is transmission via airborne droplets. So water droplets in the air. So, someone that doesn't cover their mouth when they're sneezing or coughing, this is what can happen. Okay, you start seeing them sneezing and coughing. Vehicle. Vehicle transmission is transmission by inanimate reservoir. So water, food, air, spores. Okay, all of these are examples of vehicle transmission. Alright, and usually it will infect many people. So here's an example of the water, the food, and someone sweeping. Vector transmission involves arthropods. And arthropods, especially fleas, ticks, and mosquitoes, carry from one host to another. There are two types of transmission, mechanical versus biological. In mechanical transmission, the arthropod carries the pathogen on its feet. Okay, so example, houseflies. Houseflies infect people's food with feces. Okay, so infected people get feces on their food. If flies are flown around in different places and they land on the feces and they come and land on your hamburger, that's not cool at all. Whereas a biological transmission is a pathogen that reproduces in the vector. For example, West Nile virus that reproduces inside of the mosquito and is transmitted to the host. Same thing with Lyme disease. Nosocomial infections are acquired as a result of a hospital stay. Basically, it affects 5 to 50% of all hospital patients. So this is something that's very common. Reasons for nosocomial infections is number one, the patients are the reservoirs. You have a higher concentration of diseased individuals in the hospital. There's weakened resistance, so you have compromised patients. Babies with underdeveloped immune systems. You have immunosuppression for transplant patients. The ventilation system. Breaching the skin barrier using urinary catheters. Burn patients, surgery, radiation therapy. And of course, we have resistant bacteria. So here we see the relative frequency of nosocomial infection, and the top infection that we see are urinary tract infections. Okay, and it's usually related, as mentioned here, to using urinary catheters. Then it's surgical site infections. Okay, this is another incidence that we see. Then from there, lower respiratory infections. So this is related to respiratory devices that help us to breathe or to administer medications. Then comes bloodstream infections, and it could be from, intravenous catheterization using IV. Okay, so all of these are things, and then other is like 17%. Some common causes of nosocomial infections is definitely Staphylococcus involved here. Enterococcus is for surgical wounds. Pneumonia, Clostridium difficile, simply because of the antibiotics that's being prescribed. Okay, so all these are different organisms that will cause infection. Examples of compromised hosts: AIDS patients due to the loss of T cells, therapy, radiation, steroid, immunosuppressed, burn patients that have a loss of skin barrier, infants with underdeveloped immune system, other diseases such as diabetes, leukemia, etc. And of course, in specialized care units, burn wards, oncology units, oncology is cancer units, hemodialysis, people that are on dialysis, as well as intensive care. So how is this happening? How is nosocomial infections occurring? Well, the chain of transmission is number one, probably through direct contact. Hospital staff to patients, not washing your hands, not doing the proper aseptic technique. patient to patient. You're in a room with another patient that's coughing and you're sick too. Same thing. Indirect contact through fomites using urinary catheters, needles, scalpels, and of course the HVAC system, the ventilation system. Emerging infectious diseases is when we have a sudden prevalence. So we have diseases that are new, increasing in incidence, or showing a potential to increase in the near future. So it's not always a new organism. It could be an organism that's reemerging, that's going through reemergence. What are some reasons or contributing factors for an EID, an emerging infectious disease? Well, one could be genetic recombination, could be the germ warfare. Okay, when we say germ warfare, we're talking about the use of germs as a bioterrorism effect. So people using, I should say with the SARS outbreak or with saying that they have smallpox, that's scary. Okay, evolution of new strains, ecological changes in the ecosystem, inappropriate use of antibiotics and pesticides, so antibiotic resistant strains, changes in the weather patterns. Sometimes the weather is not the same. Modern transportation. Remember in the old days, we used to get around on boats. Now we could be in London in 6-7 hours on a jet plane. And that's believe how West Nile virus arrived. And of course, public health failures. For failures in educating the public. Epidemiology is the study of when and where diseases occur, how the disease affects different types of people, and the methods of controlling disease. There are 3 types of investigation in epidemiology. Descriptive, which is the collection and analysis of data regarding the occurrence of disease. Analytical, comparison of a disease group and a healthy group. And experimental, the study of a disease using controlled experiments. So this table shows us some examples of those 3 types of investigation. So descriptive, we're trying to describe the occurrence of the disease. So what he did was he collected and analyzed data of an outbreak that occurred in London, and he was able to actually trace it back to a water pump in London and found that that was the reason for the cholera. Ignaz Semmelweis, if you remember back in chapter 1, we talked about him, and he did the experimental. He did a disease where he used a control experiment where he showed, okay, if you don't wash your hands, then you see an increase in the incidence, but if I wash my hands, then we don't see puerperal fever being passed on between those OB patients. And then finally, Florence Nightingale, she did the analytical where she compared the disease group to a healthy group, and she tried to determine the probable cause. So she showed that improved sanitation decreased the incidence of epidemic typhus. In epidemiology, in case reporting, healthcare workers must report specified diseases to local, state, and national offices. And nationally notifiable diseases, physicians are required to report occurrence. So how many flu diagnoses did you have this month? How many HIV diagnoses did you have this month? Hepatitis, so on and so forth. Okay? And we'll see, the tracking done using epidemiology. We see that the Lyme disease from 1999 to 2010, we'll see that it was kind of low and then it started to rise again and now it's on the decrease. But then if we look at 1 year, we'll see that it was more prevalent to get Lyme disease in July, of course, the summer months when ticks are happy. And then we see the number of TB cases going down. We're trying to get it down really low. So the knowledge of educating people about TB has helped to bring it down to low levels. We haven't got rid of it. It's still around, but we don't see it as often as we did in 1948. Epidemiological terms, morbidity is the incidence of a specific notifiable disease, so the number of affected by disease in a population. Mortality is the deaths from notifiable diseases, so the number that dies from a disease in a population. The morbidity rate is the number of people affected in relation to the total population in a given time period. The mortality rate is the number of deaths from disease in relation to the population in a given time. So the CDC, the Center for Disease Control, collects and analyzes epidemiological information in the United States. Then, every week, they publish a morbidity and mortality weekly report, an MMWR, for the public like you and I, to look and see what diseases are on the rise. This is how the news people know what to talk about, what's on the rise and so forth. They read this article. So if you want any information, there's the link for you to go to and check it out. Okay? Here ends Chapter 7.